Hello everyone, this video is going to be a walkthrough of the CPT 2022 digestive system. As always, we have our pens, our tabs, and our highlighters or markers, and we will get started here. All right, so if you have not yet, go ahead and put your tab in. It starts on page 341 in the 2022 manual. This is where we have our table of contents. This walkthrough is kind of going to be a little bit like the cardiovascular walkthrough because, as you'll see, it is a massive section just because the digestive system covers so many different organs and systems or parts of the body. A lot of things can be covered just by saying the digestive system. So yeah, I'm going to show you here on the next page. You can see that the digestive system really starts with the mouth and it goes all the way through the whole body, and it includes all of these accessory structures and organs, including liver, colon, appendix, pancreas, all kinds of different stuff in here. And so we've got sections for each of those different organs and structures. So there's a lot to cover in the digestive system. However, since we are focused on the national exam, what is important to remember is that you are not going to need to be an expert on any of these systems. Once you are working in coding, if you are working for a gastroenterologist or some other kind of facility that works mainly with the digestive system, you'll become an expert in whichever section you're working in the most. But for the purposes of the national exam, we just want to get a brief overview. We want to kind of understand the flow of it, what's covered in this section, so we know what to do when we see codes from this section, right? So like I said, it starts on 341. That's where we have our table of contents. Because it is such a huge section, I don't find this table of contents particularly helpful. So you might want to use the index more when you're working in this section. However, you will notice that the sections are pretty standard in that they're repeating this same pattern pretty much with very little variation: excision repair, other procedures, occasionally incision repair, other procedures. So we've got a pretty familiar pattern going through here. However, just because there are so many different structures and organs being covered, I don't find this table of contents to be super, super helpful. But let's go ahead and look through the sections. As I said, the digestive system starts with the mouth, and that, of course, is going to start externally with the lips. So we do have some procedures related to the lips here, which is going to be excision and repair. We also have the vestibule of mouth. So what does that mean? That would be parts of the oral cavity, so things that are outside of the teeth but still inside the mouth, like the inside of your cheeks. That's what we're talking about here. On the next page, we get into the tongue and the floor of the mouth, which is fairly self-explanatory. And then we do have dentoalveolar structures. And I'm going to just warn you guys, this section has like a lot of complicated and challenging words. And so I'm not going to try to say most of them. But what we're talking about here is there are some associated dental procedures that we do outside of actual dentist office or dental surgeons. And there's a whole different manual just for dental procedures, but we do have some associated procedures here in the CPT, and that's pretty much just here in this section, okay? And then we have the palate and the uvula. That's that fun little dangly thing in the back of your mouth. And this is important to note because you will occasionally see on the national exam questions about cleft lips or cleft palates repair. And so that is here in this section. So on 347 is where you're going to see cleft lip, cleft palate repairs. Then we have salivary gland and ducts, pharynx, adenoids, and tonsils. So that's where you get like your tonsil removal, tonsillectomies. going to be in this section. And then we get into the esophagus. And so the esophagus is going to be a very long section. There's a lot of different procedures that take place within the esophagus because it is there at the very top of like your digestive tract. And so what you'll see here a lot is endoscopies. So that is going to be when we have a tube going down your throat for visualization. And there's a ton of codes about this. And what's important to note here, when you were in this section, you can see I've already done some of this, but let me use a highlighter just to help bring it out. So what's important to know when you're working in this section is it rigid or flexible? Is it diagnostic or surgical? Is there some kind of biopsy or removing a foreign body? Okay. So there are all kinds of different codes in here, and a lot of them are going to be very, very similar. And you'll see that we have lots of indented codes as well. So remember, that means it's going to mean everything up until the semicolon in the code above it, right? And so here's the semicolon for that one, okay? And so that does help us understand what the next code is going to be. So make sure you understand, is it purely diagnostic? Are we doing some kind of biopsy, or are we removing a foreign body? So what's the difference between biopsy and removing a foreign body? Biopsy would be we're taking a tissue sample directly from the esophagus. A removal of a foreign body would be something that's not supposed to be there and we're taking it out. That doesn't necessarily mean they've swallowed something foreign, but maybe it's some kind of something that's existing there that shouldn't be there that we've taken out. And then there are other procedures that can also take place, balloon dilation, insertion of a wire, all kinds of different things that can happen. But the main things I would want to point out is it rigid or flexible? Is there a biopsy, or is there a removal of a foreign body? Okay. And there's all kinds of different endoscopy procedures here. And that's probably what you're most likely to see on the national exam from this section, just because there are so many codes related to it. And then on page 354, we get into this super long, complicated word that I'm not going to even attempt, but they are called EGDs, okay? So if you want to put a tab on this page, or you just want to make a note of it, that this is what EGDs are, if you see that in notes, because I'm not even going to try, all right? And there are illustrations to kind of show you what they are and how far these scopes go, okay? And the with this section, it's going to be kind of the same, where we want to know, is it flexible or rigid? And then you want to really pay attention to what is indented, okay? Because that is going to really specify, did we do some kind of injection? Did we do some kind of ultrasound? Did we take a biopsy? Okay, so that's what you'll see in this section. And then on 357, this is where we get into ERCPs, which is another very long phrase that I'm not going to attempt. And if you would like to put a tab here, I would, just because this is another term you will see a lot, and you might see questions about this on the national exam as well. Okay. And again, you're going to want to know what is in the indented section that makes it unique, right? So we've got lots of indented codes here. And those with ERCPs, that's usually going to mean there's some associated procedure, or we are destroying something, like you see here, we are destroying calculi, or we're removing some kind of debris, or something that's built up, like calculi is something that has built up within that structure. And then we also have removal of foreign bodies again. And then here is exchanging of stents. So lots of things that are going to make these indented codes unique, and you need to at least draw your attention to them. You don't necessarily need to understand them all, but you do need to draw your attention to them. Then we are going to get into laparoscopic procedures. And remember, when we're talking about laparoscopies, they always include surgical laparoscopies, always include diagnostic laparoscopies. So make sure you remember that, because that's likely a question you could get on the national exam, where they might try to trip you up. Laparoscopies usually are going to involve incisions in order to insert the tube in order to visualize the area. So that's kind of how it differs from the endoscopy. So endoscopy is going into the body through an opening, and laparoscopy is making that opening. Okay. So again, we are going to kind of rush through it. I am not trying to cheat you out of understanding it, but like I said, for purposes of the national exam, you don't need to be an expert in each of these structures. Then we have a big section on the stomach. As you can imagine, we have lots and lots of different procedures that happen on the stomach. And I just kind of wanted to draw your attention here on 365. We have gastric intubation and aspirations on code 43753. And this actually is what is illustrated here, because it's just kind of a confusing little section. It's pretty short, but it's like, what does that mean, gastric intubation? And it shows you right here what we're doing, okay? All right, and then on the next page, we get into bariatric procedures. And so that's going to most often, I've not seen any other way, be a procedure to address the size of the stomach in order to treat morbid obesity, okay? Then we get into the intestines, and this section does not include the rectum, so it's just the intestines themselves. And you do not necessarily, like I said, you don't have to be an expert on any of this, but if you can know the different main parts of the intestines, that can really help you. I can post a couple of videos that kind of do a walkthrough of the digestive system, because it just makes more sense if you can, one, understand the flow of the digestive system, the different structures that are associated, and then the words that are used to describe the different parts of the intestine specifically, because often you'll see the same procedure over and over, but the only thing that's different is which part of the intestine we're working on, okay? Whether that's like the ileum or the colon, or, some other portion of the intestines, okay? All right, and we are going to keep going through. I want to see if there's anything specific I wanted to point out. Stomal endoscopies. So normally, if we're doing an endoscopy, we are, like I said, going through an existing opening. A stoma is going to be an opening that we have created. So that doesn't mean like with a laparoscopy where we're making an incision in order to insert the laparoscopy tube or device, but a stoma is something that's already been made in a previous procedure, not exclusively for the use by endoscopy, for the endoscopy procedure. But like if you have a stoma for your colon, and then it might be associated with like a colostomy bag or something like that. And so we can use that opening if we need to visualize that area. So that's what a stomal endoscopy is. All right, and then we get to Meckel's diverticulum and the mesentery. And this is confusing. I didn't know what these were when I first started working here in this section. So Meckel's diverticulum, that's not something that exists in everybody. It is a congenital anomaly. So it's an abnormality. It's not something everybody has, but it is common enough that we do address it in its own little section here. And then the mesentery is the tissue in the abdomen that holds the intestines in place. It's like folded tissue. So that's what this is about. And there's only 3 or 4 codes related to this section, but I just kind of wanted to explain what it was. Then we get into appendix, colon, and rectum. Proctectomy in this section, that is the removal of the rectum, okay? That's what that means. Keep going through here. And this is also the section where we would see colonoscopies, which are going to be very, very common. Then we get into, we have laparoscopic procedures, repairs, manipulation, and another catch-all section over here. And then we have a section on the anus, and most of this is going to be related to hemorrhoids or other fistulas. So that's the main procedures that you're going to see in this section. And then we get into liver, which is obviously a very, very complex organ. And we have liver transplantation. If you want to put a tab at liver transplant, that's totally fine. It's likely you could see a question about liver transplantation. What's important to know about that is make sure you know if it's a cadaver, if they're specifying about the type of procedure done on the cadaver, or if there's a living donor, exactly what's going on there, okay? Read this whole section. It's super short if you are working in liver transplant. Then we get into the biliary tract, and that's going to include like bile ducts and associated structures around the liver, and also the gallbladder. So I wanted to point out, yeah, once you get into the excision section, this very first one here, this is the removal of the gallbladder. So I'm sure some of you have had that procedure, know all about it. But if you don't, or you're new to medical terminology, that's what that is. I would make a note of it in your book so you know what it is. Then we get into the pancreas. The pancreas is obviously another very complex organ. We're going to see this a lot if you are working with diabetic patients. And a lot of these are going to be biopsies and other procedures that are used to determine the stage of disease. But there's also some procedures for like addressing cysts or removing tissue that's necrotic or drainage or all kinds of different things. But you'll see this a lot when you're working with diabetic patients. Then we get into kind of a general section with the abdomen, peritoneum, and omentum. And that goes on quite a bit. And then we do have in other procedures here. That's again kind of our catch-all. In this section, what I would remember is most of the time when you are working in this section, you're going to see things like hernias, but you're also going to see a lot of procedures that require the injection of gas or air into the abdominal cavity. And so that's very, very common when you're working just in the abdomen. I mean, if you're working in any part of the digestive system, you're going to see some kind of introduction of air or something like that, but you see it a lot more when you're working just on the abdomen. You're going to see that included in the description of the codes, okay? So I would not necessarily look for a separate code related to the inclusion of gas or air or the introduction of a gas or air to the abdomen. If you see that in a report document, I would just go look for that main procedure and see if that's described. Otherwise, it's just kind of assumed. All right. So like I said, this is a huge, huge section. You don't have to be an expert on any of this. You definitely don't. And what is most important is to understand kind of the flow of the digestive system, which kind of structures are going to be associated with it. Make yourself familiar with this illustration so you kind of understand it does start with the mouth and goes all the way through the body, and there's a lot of organs that are associated with it, okay? Ones that kind of don't immediately come to mind are like the liver and the pancreas and the gallbladder. It might not immediately think about the digestive system when you are presented with discussions or codes or reports about those structures, but those are included in this chapter. All right, so that is our walkthrough. I know it's a lot. I rushed through it, but again, think of it more like we did the cardiovascular system, where we just want a general understanding, and most likely what we're going to do on the national exam is look up each of those options, or we'll be using the index, right? I wouldn't recommend using the table of contents for this one. It's a bit much. All right, so that is all I have, and we will do another video with questions, walkthroughs. All right, thank you all. Bye-bye.